Welcome back. The British Prime Minister Boris Johnson has triggered outrage over comments suggesting the care home sector might be responsible for the country's huge death toll from COVID-19.
We discovered too many care homes didn't really follow the procedures in the way that they could have, but we're learning lessons the whole time. One of the most important things is to fund them properly, so we're putting another 600 million into COVID compliant care homes, but we'll also be looking at ways to make sure that the care sector long term is properly organised and supported.
The government's policies on this were really bad. The priority was all about the NHS, when care homes were most at risk. We had people being discharged from hospital without testing. It was only when we raised the alarm, with figures showing how many residents were infected, that the Prime Minister seemed to take any note at all.
The anger comes as figures reveal just over a third of all deaths in care homes in England and Wales were linked to COVID-19. That's nearly 20,000 fatalities, according to the latest statistics. The estimates cover the period from early March to mid-June. Now, what's been adding fuel to the flames is the fact 25,000 hospital patients in England were discharged to care homes at the height of the pandemic. Not all patients were being tested for coronavirus until April 15th, when the rules changed. Before that, priority was given to patients with flu-like symptoms. Now, it's unclear how many of those who were discharged to care homes at the time were infected. Let's get more reaction to all of this now and speak to Vic Rayner, the Executive Director of the National Care Forum. Welcome to the programme. It's great to have you with us. So, Boris Johnson says too many care homes didn't follow the correct procedures. Does that explain the huge death toll in the sector, do you think?
I think, first of all, I just want to kind of address his comments, really. So the notion that care homes have been out there not following the government guidance and procedures is hugely unhelpful. I mean, I work with lots and lots of organisations across the country who have been following that guidance as it's arrived, which has been there's been huge amounts of guidance issued, and they've been following that to the letter. And so for him to suggest otherwise is really not only unhelpful, but hugely insulting for all those hundreds and thousands of people who've been out there giving their all during this crisis.
The government is being accused of shifting responsibility. Do you think it has?
I think in terms of those comments, it's difficult to sort of read that in a very different way. I think what we really need to do is to get ourselves to a position now, urgently, that we are better prepared for any second wave that might come along. So there's lots of things that the government has started to do but still needs to put into action. So yes, of course, there's guidance, but what we desperately need is testing for all staff across all care settings urgently on a regular and routine basis, and indeed testing for all of those residents and people receiving care across the community. So there's lots of things that the government needs to do to get in place to make sure that we don't suffer the same sort of levels of losses that we've had to date.
Do you think it's right of the Prime Minister to apportion blame here? I mean, this was an unprecedented challenge for everybody.
I think this isn't the moment for a blame game. It's really unhelpful. It's not as if we've come out of this crisis. There are still, lots of care homes where there are infections present. There are still lots of hospitals with infections present. So, we've got to focus on making sure that we're getting the best care to those people and wrapping round the right support structures. So to be thinking now about who's to be held to blame in the long term is not helpful. We've got to get on and got to work together to make sure that we've got the right support in place for those homes and for those people receiving care.
Looking ahead, there's talk of a second wave. Do you think the sector is better prepared now?
I think we, as a sector, have learned huge amounts. And absolutely, I think one of the points that you first mentioned was around the testing of people who are seen to be symptomatic. Well, what we discovered very early on is that particularly for a lot of older people, the symptoms they displayed were not those that were outlined by the government. So they weren't coughs and temperatures and loss of smell. They were other things like reductions in oxygen levels and sickness and diarrhea. So if you have a system that only allows you to get tests for people who fit in within the government's symptom chart, then clearly that's not going to help some of those most vulnerable people. So those kind of things we have learned. And hopefully, by moving forward with a much more rigorous testing regime, we'll be able to ensure we pick up those who are both symptomatic and asymptomatic. I think there are other things that we have still not got right. We've still got a very kind of fractured PPE system. We still haven't got the right clinical support wrapped around those care homes and those people within the community. So lots more to be done to get us to the place where we're ready for a second wave, should it come along.
Vic Rayner, Executive Director of the National Care Forum, thank you for your time.
Thank you.